Biceps tendonitis and tendinopathy are a common cause of shoulder pain. Both conditions can result from overuse, improper technique, or insufficient conditioning. They also share a key to recovery, a very specific rehabilitation program. I'm going to show you an incredibly effective shoulder and arm exercise program. It's designed to not only address pain, but also to enhance mobility and improve function. The goal is to restore your quality of life and empower you to confidently pursue your passions without restrictions. Hey everyone, Dr. Jeff Peng here. This shoulder and arm rehabilitation program is designed to be done 3 times a week for at least 6 weeks. Commit to the program and you will see significant improvements to strength, range of motion, balance, coordination, and functional abilities. The only pieces of equipment you will need are either dumbbells or resistance bands. Okay, so one of the first problems we need to address is muscle tightness, which can limit both range of motion and mobility. This tightness leads to repetitive friction, resulting in local inflammation and potential wear and tear. So what we're going to do is focus on stretching out the biceps muscle. Stand facing a wall or sturdy object and raise your arm out to your side. Put the thumb side of your hand against the wall with your palm facing down. Keeping your elbows straight, rotate your body in the opposite direction of the raised arm until you feel a stretch in your biceps. Hold this for 30 seconds and repeat for a total of 2 times. Next, we're going to work on strengthening the biceps muscle and tendon. When you first start this rehab program, begin with a light weight. As you progress every week, you can slowly add more weight to increase the load through the muscles and tendons. Grip the weight in your hand and bend your elbows so that your hand moves toward your shoulder. Hold briefly at the top and then slowly return to the starting position. Perform 2 sets of 15 repetitions. Next, we're going to focus on strengthening the muscles surrounding the shoulder to help support the biceps and promote muscular balance. We'll start first with forward flexion. This targets the anterior deltoid and the upper portions of the pectoral muscles. Stand with your feet shoulder width apart. Hold a dumbbell or resistance band and slowly lift upwards in front of you. Raise the weights until your arm is at shoulder level, pause briefly at the top, and then gradually lower to the starting position. Perform 2 sets of 15 repetitions. The next exercise is shoulder external rotation, which will help strengthen the rotator cuff muscles and provide stability to the biceps tendon and shoulder. Lie down on your unaffected shoulder. Bend your elbow to 90 degrees while holding a dumbbell. Keep the elbow pressed to your side and raise the dumbbell by rotating the shoulder outwards. Pause briefly at the top and then gradually lower to the starting position. Perform 2 sets of 15 repetitions. The last exercise is shoulder internal rotation, which also helps target the rotator cuff and provide balance and stability to the shoulder. Lie on your affected shoulder. Bend your elbow to 90 degrees while holding a dumbbell. While keeping the elbow close to your body, raise the dumbbell by rotating the shoulder inwards. Pause briefly at the top and then gradually lower to the starting position. Perform 2 sets of 15 repetitions. Remember, the goal of this rehabilitation program is to eliminate pain and restore function. Commit to this exercise regimen 3 times a week for at least 6 weeks, and you will see tremendous improvements. As you progress with the program, remember to slowly increase the amount of load through the muscle and tendon by adding more weights. This can be done with both dumbbells or resistance bands. Lastly, for those who continue to struggle with pain, you may have been recommended a cortisone injection to treat pain and reduce inflammation. But there's something new that I've been doing for my patients, and it has transformed how people recover. Check out this next video where I'll reveal what it is and show you how it can fix your shoulder pain for good.